And welcome to our podcast, Hello Apollo, a weekly podcast on health, wellness, and well being. I'm your host, Dr. Karan Thakur. Each week, we take a health issue and discuss it in detail with our experts from the field to bring to you credible information to keep you healthy and safe. And this week is no different. I will be discussing an issue of great importance, especially one where we are now making new commitments to ourselves, new resolutions, and have left behind probably about a month of a lot of enjoyment and time with family. And I'm talking about the issue of dieting, weight management, and the perils of weight gain. And no better person or people to address that issue than Dr. Arun Prasad, Senior Consultant General, Bariatric and Robotic Surgery at Indraprastha Apollo Hospitals, and Dr. Deeba Siddiqui, Bariatric Nutritionist at Indraprastha Apollo Hospitals. Dr. Prasad, Dr. Deeba, welcome to the podcast.
Thank you very much. And this is a great initiative. And your opening statement was very apt because when it comes to New Year's resolution, 90% of the new do with diet, exercise, or weight. And everybody profession are having trouble when it comes to weight and obesity. This is mainly due to the changing lifestyle which has taken place in our country, especially in the larger cities and the metro.
Right. So, and thank you for putting it into context why this is an important subject right now and why we are seeing it. But before that, Dr. Prasad, I'd just like to begin by asking you, what are the perils of being overweight or gaining a lot of weight?
Okay. So, as I would like to say, obesity is the mother of diseases. And obesity leads to diabetes, blood pressure, heart disease, kidney disease, liver disease, and even cancer. So a lot of people who are coming to us in the hospital for treatment like heart surgery or kidney transplant or for sleep apnea, for diabetes complications and surgeries are there because this problem started with obesity. So it's very important to tackle this obesity right in the beginning phase. And the good part is that obesity can be prevented.
Right. Right. So it can be prevented, but there are enough downsides that are there. And Dr. Prasad, why do we gain weight? I mean, what is the mechanism behind it, very basically?
Okay, so the most simple mechanism that I can explain is what we call as a set point.
Right.
So if my weight, for example, today is I get ill with typhoid and my weight goes down to 65. As soon as I recover, I am going to feel hungry and my weight is going to go back from 65 to 70. Right. However, when I start binging from Dashera to New Year's, at the end of this period, if my weight had gone up from 70 to 75, one would expect that nature should do some justice and make me feel anorexic. That is, I shouldn't feel like eating so that I can lose weight. Nature should help me, but actually there is no help. In fact, at the age of 75, I probably start feeling more hungry because I have created imbalance in my body insulin levels and the sugar metabolism, and makes me feel more hungry, more craving for sweet things. So when I go on a diet and start losing weight from 75 back to 70, nature and the body says that no, the new set point for you is 75. So if I try my best, I go down to 70, I'm going to feel very hungry at the weight of 70, and my body will try and take my weight back to 75. So this perhaps is the most simplistic explanation of what we call as a set point theory. Deeba, do you have any comments?
Yeah, I would like to add, whenever we are doing extreme dieting, then we are losing our muscles, and because we are not following the balanced diet, and just in that process, body things like that, assume like that we are state or in disease condition, and body start reducing the resting energy expenditure, and start conserving all the energy. And just because of that, whatever we are eating, body is not using it as an energy source, and body start conserving that, and we start gaining weight. Metabolic rate become very slow, and we start gaining weight.
Right. So that's a fascinating theory, actually, Dr. Prasad and Dr. Deeba, on set point. It's not a theory; it's a mechanism. So that's fascinating. I think because a lot of people do talk about weight gain and why it happens, and they base it just on the calorie intake. But here we have a mechanism which is actually regulating, and rather unfortunate for us that it regulates upwards more rather than downwards. So thank you for those insights. So now that we know that it is a health problem, and it tends to happen at this time of the year, and why is it so tough to keep it off? But what are some of the strategies that one can deploy, sustainable strategies, to lose weight or to maintain weight?
For maintaining good weight, we should have, first of all, diet is the most important part, cornerstone of all the things. We should have a well balanced diet, good protein intake, adequate sleep, because the growth hormone formations takes place only when we sleep. That's why, and the most nowadays I'm finding most of the persons are not having the adequate sleep. That's why not burning the fat during night time. And beside that, obesogenic environment, like easily available junk foods and all these can cause the weight gain. And we have to avoid that. And beside that, we should have a good physical activity, because whenever we are having the good muscle, then metabolic rate will also increase, and that will burn the fat.
Right. Dr. Prasad, you run a very successful bariatric clinic and practice. So when a person comes to you, typically saying that, look, sir, I need to lose weight, or I need to learn from you to maintain my weight, how do you approach generally? How do you approach such a request?
Right. First, we need to go through the lifestyle of this patient. So we sit and have a discussion, both me and Deeba, as to what kind of lifestyle this person leads. And the lifestyle basically revolves around the eating pattern, eating timing, the composition of food, the proportion of carbohydrate, fat, and protein in their food, then what kind of physical activity they are doing with respect to anaerobic and resistance to their muscles, and lastly, their sleep pattern. So these are a few of the crucial things which we have to identify. And I would like to say 80% of the problem is related to diet. So unless you concentrate on that 80%, going on an occasional jog or treadmill is not going to change things much. When it comes to diet, again, the most crucial part is you should be having a diet that you can sustain. So if I can go on a keto diet or some fancy diet for a month and lose a lot of kgs over a month, but not be able to maintain this for the rest of my life, it's pointless. Yes. So it's better to lose 1 kg a month for the next 12 months than to lose 12 kg a month in 1 month and regain all of that back in a month or two, because that's actually harmful and damaging to the body and the metabolic regulation systems as well.
Right. So I'll come to Dr. Deeba on the diet, since you said it's 80% of the addressable. But on that 20%, which I'm guessing would be increased physical activity, Dr. Prasad, what is your advice to people who are now waking up in January and now wanting to get onto an exercise regime?
Okay, so the idea is excellent. If somebody wants to get onto an exercise regime, I welcome the idea. I support the idea. I fully appreciate the idea that a person has at least taken the first step. The first step is to decide that, yes, I'm going to go on an exercise regime. So when you go on an exercise regime, you have to have a balanced exercise regime, especially if you are older than 40. You should ideally have some kind of an advice, a gym trainer or someone who can assure you and ensure that you don't damage yourself while trying to get your six packs. So a combination of aerobics, a combination of some weight resistance exercise, then the right kind of nutrition around it. For example, taking some carbohydrate to preload your system